Adherence to treatment for diabetic patients is a heated global health topic. These treatments usually requires long-term behavioral change, which is challenging. To support treatment adherence, primary healthcare facilities are offering accessible health services. However, they are now underutilized. In China, a formal gatekeeping mechanism for care referral is missing. Patients are able to approach secondary or tertiary hospitals directly. Due to their mistrust of the service quality, patients are not that willing to use primary healthcare. The fragmentation of primary healthcare and clinical services also hinders the management of type 2 diabetes. Moreover, the lack of a continuous medical record system causes inconvenience for patients and doctors as well. Patients also have limited access to their own physical examination record, making disease self-management difficult. Besides, patients don't have enough reliable information to choose suitable healthcare services, such as the location of the health facilities or types of services they should acquire. On the other side, primary healthcare workers and family doctors finding following up with their patients challenging since they cannot see the full medical profile and the past treatment records. In addition, patients show a higher level of interpersonal trust in primary healthcare doctors. So it is possible to utilize such strength of primary healthcare to transform this trust from primary healthcare doctors to the trust of the healthcare system. The rising prevalence of type 2 diabetes and population aging also pose a challenge of type 2 diabetes management. Such difficulties can be addressed through emerging technologies. Here, our group presents the Health Map, an innovative approach that helps the management of diabetes care from the system level.
The Health Map links multiple systems, including the electronic public health and clinical record systems, a police system with population data, and an interactive system for patients to upload their own data. Powered by big data, it serves as an electronic information system, a remote monitoring system, and a health education system. For primary health care providers, it can assist them in routine comprehensive diabetes management. For patients, it can benefit them in receiving continuously health service. Now, let's map. For those health care providers who are plagued by frequent follow-up tasks, emotional support, close attention to patients' change, our health map can help them better track patients' health and adherence and organize their follow-up tasks more efficiently. HealthMap allows providers to monitor their patients' health status regularly. We also address the issue of fragmented healthcare records, supporting providers in understanding their patients more effectively. Through the HealthMap system, providers can view their patients' comprehensive profile, including the demographic information, family history, so they can provide health services accordingly. This function can help doctors better identify patients in need of extra attention, such as the elderly and the disabled. Along with the map, a chatbot will work as a virtual professional guide and assistant for providers. The chatbot is trained using national technical guidelines and published literature on diabetes. It can offer technical support to doctors as references. Besides, chatbot can also remind doctors of their follow-up tasks through the calendar form. It can also alert the doctors to the at-risk patients via pop-up windows and give them feedback on patients' adherence indicators. For example, whether they take their pills or not.
For patients, the Health Map is a mobile application. It allows patients to check their health conditions, develop self-management capacities, and obtain health services more easily. Patients can access their health records from various facilities in this region at any time on the app. This provides convenience. As mentioned earlier, patients provided data like weight, BMI, and self-tested glucose levels can serve as another important data source for our system. As more data is collected over time, we can improve our patient profiles. This allows patients to better understand their health conditions and how lifestyle factors can influence their disease progress. Besides, the Health Map serves as a tool for enhancing patients' self-management behaviors. Patients can set reminders for lifestyle changes and earn rewards for fulfilling regular self-monitoring tasks. In addition, the Health Map is also a health services map. Connected to the electronic system of community health centers, it provides a live map displaying on-duty health workers and a patient weight count. Patients can therefore use this map to find the closest health centers, check doctor schedules, and estimate wait times. This saves patients' time and prevents overcrowd in clinics. Therefore, the health map assists healthcare providers to inform and motivate patients and their families. After that, our system makes efforts to create more interactive ways between patients and doctors. In China, family doctors often use WeChat for patient follow-up and health educations. To ease their workload, we equip them with a chatbot assistant. It can post daily health education materials in the WeChat group to ensure patients receive consistent and reliable educations while saving doctors' time. If an issue cannot be solved via the online group chat, doctors and patients can also initiate remote consultation through the health map. Providing feedback is also important. The health map can automatically generate monthly and annual reports on patients' diabetes management, offering insights to both patients and healthcare providers. This data also contributes to external evaluation of the health map's efficacy, to generate evidence-based results to support the primary healthcare system enhancement. We not only want to inform patients about their health condition status, but also promote a community sense of progress and motivations.
During project implementation, collaboration among multiple stakeholders presents a barrier. Various stakeholders also express concerns regarding the security and privacy of information. To address this barrier, the government should promote effective communication mechanisms among stakeholders to ensure timely problem solving. Furthermore, setting up data privacy and the security protocols in the forming a supervisory committee is the key to quickly dealing with security risks. Another obstacle is the use of digital devices. This issue is particularly pronounced among elderly patients. One proposed strategy involves the creation of family networks, where younger family members alongside community volunteers can assist elderly patients by reminding them to take their medications on time. Furthermore, elderly patients are generally capable of basic functions such as answering calls. In light of this, we add a chat box feature that would make regular voice calls to these patients. This serves as an automatic reminder system, ensuring patients receive timely notifications in an easier manner.
With a budget of $1 million, we adopt a stepwise plan to launch the initial program at the county level first, then scaling up to municipal, provincial, even national level. In the first year, our focus is on laying the foundation. We are channeling our resources to build the Health Map app and draft the Health Map. This phase is critical to guarantee the tools we create are both user-friendly and data-rich. As we move into the second year, our strategy shifts towards promotion to expansion. It's all about getting the Health Map app into the hands of users and securing effective data sharing. In our third year, we focus on maintenance and assessment. We will monitor how the app is used and the scope of its impact on community health, making adjustments and improvements as well. The end of each year is a checkpoint phase. This is when we critically evaluate all aspects of the program and plan our next steps. We have set aside 20% of our budget, that is $200,000, to manage the project and cover various subsequent expenses. Another $200,000 will be allocated for developing the platform and leasing the necessary servers. $200,000 is earmarked for product design of the platform. We have dedicated $100,000 to research, training, and evaluation activities needed to design, develop, and build the service model for a mental health services platform. Lastly, $300,000 will go towards compensating the medical professionals and volunteers who work on the project.
We aim to streamline the delivery of telemedicine services and health-related knowledge to not only patients themselves, but also to the rest of the community. If the project proves to be successful, we hope to expand and broaden the scope of our target population to different demographics, because medication adherence is important not only for diabetics, but for all patients.